Hello, everybody. My name is Anice. I'm from Brazil, and I hope you understand my English and my accent. It is a great pleasure to be here with AAIP members and being able to share the initial part of my master's work, referring to the preparation of dogs to work on a clinical trial in animal-assisted therapy and physiotherapy. Therefore, this presentation is about an experimental protocol for adapting dogs to the clinic where they will perform in pediatric neurofunctional physiotherapy sessions, assuring their well-being. So, I would like to introduce myself first, but I'm not going to be long on this. My name is Anice Nascimento. I'm physiotherapist, but my first major was law, where I worked for 20 years. My first job in AI was in 2004, and my first AI course was in 2005. Since then, I've been taking courses and updates in the area, including dog training in positive reinforcement and assistance dogs. I've been an AAII member since 2022 and recently an AAIP member, aiming to strengthen my role as professional of AI. I am the creator of the Projeto Sorriso de Mona Lisa's Smile project, focusing on AAT and physiotherapy, but also in education and positive reinforcement. The master's clinical trial is registered in the Brazilian Clinical Trial Registry, ReBEC, where it can be consulted in English, and data collected will continue until December 2023. The intervention was carried out in animal-assisted therapy, and based on Howell et al. 2022, I used the nomenclature therapy dog only for AAT, visiting dogs for AAA, and educational support dogs for AAE. And who takes part in the session? The participant, children 6 to 10 with cerebral palsy, the dog handler, an individual who has training and experience in dog handling, training, and behavior, physiotherapist, therapy provider, the trained and selected dog. I am the dog handler. And what about the dogs involved in this study? What we need and what is the protocol for the dogs participate in this study? They have to be over 2 years old because the maturity of the dog is very important. Have at least 1 year of training with positive methodology prior to the beginning of the research. No aversive method may be used to guide the dogs, including as an aversive choke collars, unified collars, or variations. Have gone through a specific selection process and already have experience in AAT modality and physiotherapy. Have undergone a veterinary health assessment, up-to-date vaccinations, blood count, and stool test prior to the beginning of the intervention and renew it every 4 months. The two dogs selected were Moana, Golden Retriever, age 5. Moana was litter selected and has been with me since she was 60 days old. Has been socialized and trained specifically for AIs and works well with children and adults. Working with me in AAT and physiotherapy since 2020. The other dog, Kenai, Poodle Mix, age 6. Kenai was selected from a dog shelter when he was about 1 year old and has been with me since he was about 18 months old. Has been socialized and trained specifically for AIs and works well with children and the elderly. Working with me in AAT and physiotherapy since 2020. And what about the theoretical basis of the experimental protocol? Studies have given us a basis on looking at the well-being of AI's dogs. One example of these studies is this one, 2016 Lisa Glank study that shows the influence of environmental factors and the importance of human handling on promotion of successful human-dog team. And also this study, a 2021 Lisa Glank study too, has brought us the reference of the 5 domains of animal welfare and the need for consent for a real partnership work in AI. And about the 5 domains: nutrition, environment, health, behavior, interactions, mental states. These domains are interconnected precisely because the animal's organism functions as a dynamic and integrated entity. The internal states of the body, external circumstances, and mental states are related, and interactions between the domains inevitably occur. How animals feel in certain situations and under different stimuli. And we always have to wonder if the dog is giving us consent to the intervention. So, one more. What was the first step in ensuring that the entire team of the clinic, where the data we collected, understood the animal welfare procedures that will be applied? So, that's so important to inform the team about all procedures. A class was given to the entire staff of the clinic, including those who will not act directly in the collection, the other professionals, secretary, administration team, all staff. Inform about always consult the dog's handlers before interaction when out of session context, the responsibility of the handler. Respect periods of rest of dogs. These are important criteria of AAII standards of practice for animal-assisted therapy. First, prior to the program, the dog handler shall complete a facility visitation with the population served without the dog. Second, specific AAT areas, environment to carry out planned sessions shall be identified. Third and fourth, dogs shall be under regular veterinarian supervision. And dogs shall be comfortable and safe during any transportation usage. And how important is the standards for handlers? And all converge to the responsibility of the handler. And in this study, the handler is key. And this is step by step of what was done. First visit without dog. Visit the place where the session will take place. Check the floor. Assess the needs for non-sleep padding. It's very important. This is the padding. Where resting place could be. I usually use a fabric dog crate, and the brown one at the bottom of the room is my fabric dog crate for Moana. Alternative exit place for the dog water here too. Talk to the physiotherapist in charge about the goals of the therapy and assess what resources will be needed to work with the dog. Forwarding veterinary documentation to be filled at the clinic. Vaccination record, blood count, stool test, veterinary health certificate. Second visit with dog. It's very important to evaluate the dog's behavior in the environment and with people, all the staff, other professionals. Assess whether there is any sensitivity to be worked on, auditory, visual, etc. Check the temperature of the room. Show the dog where the water is. Show the dog where the pee spot is, if needed. The pee spot is this grass one for both Moana and Kenai. Introduce usual clinical sounds and movement. And this is Moana in her first visit in the clinic, my second visit. And this state of calm is very important in all those visits. I use this board for evaluation, and 2 points are very important. First, evaluate the dog's behavior before, during, and after the technical visit, relating the behavior to the 5 domains. Second, evaluate the dog's behavior before, during, and after the transportation. And so, evaluate physical, functional domains, mental domains, and the welfare status at all. Third visit with dog. My third visit and the second visit of the dogs. And this is for evaluate changes between the first and second visit of the dog, and finalize the training plan to achieve the goals and the sessions. And this state of calm is very important to begin. And this is Moana in her second visit. And this is canine and second visit. So I repeat, this state of calm is very important. Eating, playing, drinking. The following week, the study collection began with the children getting used to a stuffed dog before the introduction of real dog and the protocol of the study. On left is stuffed dog for Moana, and on the right, the stuffed dog for Kenai. This semester, I'm going to finish the second part of data collection and hope to have some more news for you next year. So this is my contact info in case you'd like further information on this topic. Thank you very much for your attention. Bye.